Welcome to Offscript. Tune in every week to hear the stories of and insights from NPs. We're your hosts, Maxine and Danielle, two technologists who are passionate about the future of patient care.
Our guest today is April Fogg. April is a nurse practitioner and social media expert. She is currently a primary care provider at an NP-led direct primary care practice, a business owner in medical aesthetics, and an influencer with over 70,000 followers. In today's conversation, we discuss April's career path, her day-to-day as an NP, her experience building a TikTok following, and much more. April, thank you so much for joining us. Could you please give us your own brief intro?
Hi, guys. Thank you for having me. My name is April. I am a nurse practitioner and I have been for about a year and a half now. I work primarily in primary care, but I also do a lot of social media stuff. I have a YouTube channel, I have a TikTok, and I try to kind of bring awareness to a lot of your regular primary care problems. And yeah, that's me.
Well, we're huge fans of your content and we're really excited to get started today. So let's jump in and talk about your path to becoming a clinician and an NP leader online. We're wondering what motivated you to advance your career and become a nurse practitioner, and if there was a specific moment or realization that prompted that decision.
Had a really hard time in high school basically deciding what I wanted to do. I had always been told by my parents to get into healthcare because it was a super reliable field. And actually, both of my parents owned their own businesses. So they kind of understood business struggle. I was deciding what I wanted to do. I was thinking either occupational therapy, speech therapy, or nursing. And I went and I toured a university, their nursing department, and it was, my eyes just like came on. It was so cool to see all the interaction and the simulations that they were doing. So when I was looking into nursing, I was like, that's what I want to do. But I didn't just want to stop there. I was like, nursing is obviously an amazing field and it's so hard and nurses are so educated. But I kind of wanted to be on the other side or like take it a step further and be like the provider and be the one making the calls. You know, me, naive me at 17 was like, yeah, I want to do that. So I just kind of got it in my head. It was like, I'm going to be a nurse practitioner. I'm going to go to nursing school. I'm going to work as a nurse. And then I'm going to go to NP school afterwards.
It's so crazy to think about the decisions or the realizations we have at age 17 or 18 that then set up this trajectory. And it's very clear you made the right choice for yourself. So that is a
Yeah.
awesome outcome.
I'm always in awe that I kind of figured out what I was going to do at that age and it worked for me because I feel like for so many people it doesn't work and that's totally fine. But I don't know. I just had some type of forethought, but it all worked out.
That's great. And then what was your first job as a nurse practitioner and how did that go?
So my first job as a nurse practitioner was at a gastroenterology clinic, and it was actually a complete disaster. I hate to say desperate, use that word, but when I graduated nurse practitioner school, I was so desperate to just be working as a nurse practitioner. I had all of this nursing experience behind me and now the nurse practitioner schooling behind me. I really just wanted to dive in and I kind of took the first job that was offered to me. I had worked previously on a surgical floor, and that surgical floor did include some GI surgery. So I felt like I had some experience there. So I took that job, and it ended up not going well for the main reason that the clinic that I was in did not use nurse practitioners the way that I believe they should be used. For me, nurse practitioners are an extension basically of your doctors and your MDs, DOs, and we can provide medical care to patients. We should not be just used as scribes or used as somebody who can put in orders. And that's how I was being used at the gastroenterology clinic. And I several times tried to verbalize, hey, I didn't go to school to do this. Like I could extend my care to so many patients. We could open up so many days of me seeing patients in clinic and they just willing to work with me on that. So that was my first job. And I was there, it was probably like 6 or 7 months until I switched to primary care.
It's a bummer that your first job didn't give you the autonomy and the ownership that you both expected and deserved. We know that you have found that in various capacities since then. Would love to hear a bit more about what brought you into primary care and the experiences that you've had in primary care so far.
All just kind of worked out. I had a friend that I made after I moved to Tampa and I started nursing at a hospital. And I reached out to her during this whole period of gastroenterology not going well. It was a really low time in my life. And I was like, hey, where are you working? Because she had also become a nurse practitioner and we really bonded on being nurses and going through NP school together. And she told me where she was working and I applied for that job. And I went in, I interviewed. We were there for 3 hours, me and the owners, and then my friend talking about the job. And everything just fell into place perfectly. And I have my family nursing practice degree, so I can see patients from birth to death essentially. So I see a lot of your typical regular, like middle aged grouped people, diabetes, hypertension, a lot of thyroid disorders, but I also see a big chunk of pediatric patients. Specifically in my area, actually, we are the only non-vaccinating practice, meaning that we're the only people who will see children who their parents choose not to vaccinate. And I don't particularly agree with that stance, but everybody needs medical care. So I do end up seeing a lot of pediatric patients, which is fun. I actually thought that I wanted to do peds when I was going through nurse practitioner school. So I love doing that. And then of course I have a few geriatric patients as well, which that's like the light of my life is seeing like my older patients. I love them so much. There's just something, I don't know, that's I love them. So I see a very wide range of things and yeah, it keeps the day interesting.
That's awesome. And it's so special that you get to see different patients and different backgrounds. We've heard from many clinicians that primary care is a pretty challenging specialty to be in. And we know that's been the case for you as well. And the documentation and the charting burden, but also the fact that you really are constantly context switching. How do you navigate that piece and overcome some of those challenges personally?
I feel like I really kind of see it a bit differently than most people see it as far as working in primary care. I actually feel like it's a huge blessing to be able to see my patients as much as I see them. It really creates a good bond and relationship and a trust that they have in me. Some of my patients will just walk in and be like, "Hey, is April here? Can I be added to the schedule? Like I have this going on. I just really want to talk to her." And obviously like that makes me feel so good that I am a person that they trust so much. So I feel like I see it a little bit differently, but obviously primary care does come with its issues. So I see probably about 20 to 25 patients a day, which is a ton. It doesn't seem like a lot, like when you're just talking about it. Each patient doesn't just come in with one problem. Each patient comes in with usually a laundry list of things going on that they want to talk about. And so I love talking to them about it, but then I also have to chart about it. And the visit is allotted for 15 minutes. So, as you can imagine, it doesn't get done quickly. I use a lot of what we call dot phrases, which are basically generic phrases that I have for things that I treat commonly, like hyperlipidemia, hypertension, which does make my charting system a lot easier. I am also super efficient. So I took Mavis speaking typing when I was younger. I swear I can type so fast. And then also, my practice uses nurse practitioner students, and that has been so helpful. One, because I do love teaching, but also because they do a lot of the charting for me. They write the entire HPI, they put out the assessment, and then usually bring over ICD-10 codes. So it's really just a lot of editing for me and making things sound the way I want them to or changing things. So that is kind of how I navigate it, but obviously it comes with its issues and challenges. So, yeah.
It's such a important part of the work to not only be so relational, which you are highlighting and is clearly such a core part of how you operate, but also to figure out efficiencies in your workflow. And it's also so great that you get to mentor NP students as they're learning. I'm sure that's very beneficial for them and for you and your practice as well. We also know that you've been working in the direct primary care space. We'd love to hear a little bit more about how treating patients in that way is different than treating patients in other ways.
Yeah, so our clinic is probably about 70-30. I probably see about 70 patients with commercial insurance, Medicaid, Medicare, but then I see about 30% of patients who do not have any insurance, and we offer them a membership-based program. So they pay, it's very low amount. I don't know how much it is off the top of my head, but every month to see us whenever they need to see us. And then They also get yearly labs included with that membership. So we're talking like a CBC, a CMP, a lipid panel, and A1C. And then they get discounted labs and discounted medications through us. So it is so different when you are seeing a patient who has insurance versus seeing a patient who does not have insurance. Insurance holds you very tight on what you can and can't do at a visit. So, for example, if somebody comes to me for a pap smear, I can't talk to them about their vitamin D deficiency at a pap smear. This is an annual gynecology visit. But if somebody who is a member comes in and I'm also doing a pap smear on them, first of all, they get that pap smear at a discounted price. I think our pap smears are like $65, which is amazing. And then I can also talk to them about whatever they want. So the challenges come in when we're talking about very serious things. For example, patients who need more and they don't have insurance. So whenever you're talking about getting any type of imaging is very expensive, or even referring to other doctors, other providers, basically, as people need more than just primary care. So for instance, right now I have somebody who very concerned about potential Barrett's esophagus, colon cancer, and they don't have insurance. And we are navigating this world of they need a colonoscopy and they need an endoscopy. How do we collaborate with other providers in the area to try to get them those resources? So it's not impossible, it's more difficult, but you have to be more creative, which some people like. In the medicine world, it's nice to kind of bring those two together. So it's very interesting to do.
It sounds like the way that you approach that care is with a problem solving mindset, and having to get creative in those cases is really what helps us all grow in our own careers. So, very cool that you're helping folks navigate and really giving them the care that they need at the time they need it.
Definitely. I have to look at everything differently when I'm treating somebody who doesn't have insurance. It's kind of made me treat some of my insurance patients differently because there is so much that we do on the insurance side just to do it. For example, if somebody comes in with a sore throat, a runny nose, we run a strep, COVID, and a flu test. It's like, do I really think that they have one of those, or can I just treat what I think they have and just use my medical knowledge and my assessment abilities over crutches that we have in the medical field?
Absolutely. And using your discretion that comes from these years of education and reps is a really important way to practice. You seem at this point in your career already so mature as a provider. I'm wondering if you have any advice that you would give to your younger NP self or things that you wish you knew sooner.
I think I've always really practiced with, it sounds crazy, but fake it till you make it. You can leave the room if you need to for whatever you want. You're getting an emergency call, you need to go look something up. That's totally fine. Or you can just say to the patient, I've literally said this before, like, I don't know, let me go look it up really quick. I'll be right back. And I think it's a balance of faking my confidence versus being, hey, I don't know everything. I guess if I could tell myself one thing from graduating NP school and being like a new grad novice NP, which I still kind of consider myself, it would be that you don't know everything. You're not going to come out of school knowing everything. And that's okay. Nobody comes out of school knowing everything. When we were nurses, we didn't come out of school knowing everything. We learned so much on the clinical side, and that's okay. And patients don't expect you to know everything.
That's really special advice, and it's just amazing to hear about your reflection on what you've learned over the past couple of years, but also B, the evolution of you into your current clinical self and kind of finding who you are as a clinician, which really is so special. Would love to hear a bit about that from the influencer perspective. So, what inspired or motivated you to build a platform on TikTok, and what has that experience been like so far?
That experience has been wild. I feel like the first video that I ever made on TikTok was during COVID. And I was obviously in NP school. I want to say I was like, it must have been 2021. And it was really just me and my husband's morning routine as both of us basically floundering, like not knowing what to do with ourselves. And it was just so fun to make that little video. And as I got more on TikTok, I realized that there wasn't what I was looking for. There wasn't anybody who was in my position who was posting online. So there was nobody who was a nurse practitioner student going through it and kind of like talking about all of the hard things. But I kind of also, I don't love all of my content to be medical. I like to be it more about my life. Like I am a nurse and I am a nurse practitioner, obviously, but I also am just like a person who has her like skincare routine that she likes to show people, or who really likes this type of product, or who likes to have like a girly wind down. So I feel like I was looking for somebody who could give me a little bit of all of that, and I couldn't find it. So I was like, you know what? I'm just going to start posting videos. I was terrified that anybody was going to find them at first. It was like, these people are going to see me from my regular life or from school and be like, she's weird. Just turned into something like so much fun. And it's been difficult to navigate as far as now becoming a provider. I'm never talking about any patient specifically on my platform, but I also want to share things that I see every day and how I would go about treating them. So that part is a little bit difficult and you get in the weeds a little bit with it, but it's just been the response online overwhelmingly has been positive, that people really like resonate with seeing somebody who has a job who post online. I think that's what a lot of people are looking for these days, is somebody who's relatable. And that's what I was looking for. So it's been super fun. I love doing social media.
It's such a great origin story in terms of you personally looking for something and not finding it. So deciding to build it yourself and also just finding ways to really show up very authentically. And as a result, it sounds like the following kind of naturally grew, which is how it seems things should work out. So that's really nice. Given your clinical work and also your online presence, how do you personally see your career continuing to grow and evolve? And how do you plan to blend those things?
I think that's something that I'm always working towards and trying to figure out. I can't keep doing what I'm doing forever. I work 4 10-hour shifts and I run a bunch of social media pages by myself. And I also have a business. It's just not going to work forever. I'm going to get burnt out. So I would love to be able to incorporate everything part time. My socials are not big enough right now where I feel like I could do that full time, nor would I ever really want to do that full time unless it was revolved around providing education to other people. I'm never going to be that influencer who leaves nursing and is just posting about her morning routines or her night routines and that type of thing, because I worked so hard to get where I am and I never want to leave it. But I do see a world in which I work a couple of days at a primary care office. I do my own Botox a couple of days and then I do my own socials in between. That's really the goal.
That makes a lot of sense. Yeah, like making time for each of those buckets and then just allocating appropriately. Would love to hear a bit more about your day to day and what that has looked like for you, especially given you have these three quite different aspects that go into at least your weekly schedule. How do you structure your daily or weekly schedule to navigate those three aspects?
Yeah, so my daily schedule, it starts, I wake up at 7 a.m. every morning. I'm not a snoozer. I have always said, like, I don't know what it is. My mom taught me do not hit snooze because it's going to be harder to get out of bed. So I wake up at 7 a.m. And basically, from the time I wake up, my phone is on recording what I'm doing because I'm posting about my life. So I get ready for work and then I start work at 8:30. My patients start at that time and I see patients from 8:30 to noon. And obviously, as everybody who in healthcare knows, it doesn't always work out as perfectly as that. But I have a little bit of admin time in the morning. So I try to get to work around 8 o'clock and basically go through my clinical inbox, any images, labs, patient messages that have come across, and try to get all of those done before I start seeing patients for the day. It doesn't always work like that, but that's like my perfect world. And then I'll see patients from 8:30 to noon. I love to work out. It's kind of like my, I don't know, makes me feel better about life when I have some type of movement. So I typically go to the gym from around like 12:30 to 1:30, get some type of 45-minute to an hour workout in, and then head back to work. I am off, like my patients are off from 12 o'clock to 2. So technically that's like my lunch and my admin time. So any time that I take out of that to go to the gym is basically, it's on my time. So I'm losing my admin time if I'm at the gym for that. So I typically try to get back before 2 o'clock and wrap up any of my patient charts from the morning or any patient messages and clinical inbox stuff that I didn't get done. And then I see patients from 2 to, I think my last patient of the day is usually scheduled around 6 or 6:15. And I try to wrap up all my charts and be out of there by 7. That is like the goal ideal. And then I come home and I cook. I really love to cook. It just, I don't know, it's something about just like having the TV on and like chopping and knowing that I'm fueling my body with good foods. My mom also was like a huge cooker of dinner. So it's very important to me to cook dinner for my family, even though my family really just includes my husband and I. So I typically cook some type of dinner, again, filming everything that I'm doing except for my patient care. And after we're done eating, I sit down and I will edit any videos that I want to be posted that day. So my goal is always to get one TikTok up a day. Sometimes I get more, sometimes one is the maximum. I also have to go through my emails in the evening as well. I actually just hired a management company. So I'm very excited to have somebody taking over my emails because that's a huge part of the day. But that typically takes me to about 10 o'clock at night. And then I like to read before bed. So I wind down and I'm usually lights out, like knocked out by 10:30. And that's my routine 4 days a week. So you can see why I'm like, I need a break.
Is like every minute has a purpose. I love the saying, I'm not a snoozer. It just, you starting off your daily routine by saying, I'm not a snoozer. I'm like, oh, clearly, I know what that means now by the end of your day. And it sounds like you really do a great job of at least your office work. You confine that to the work day in the actual office, but you're bringing home, or maybe at home is a lot of your social media work. How do you manage bringing home work with you and creating some amount of separation? Or have you just given up on the separation piece?
Uh, I've given up on the separation as far as social media being different from my home life because that's so intertwined. But I wasn't always good at separating and not bringing home charting. I would say probably the first 8 months of being in primary care, I was bringing home charting every single day, at least 3 days a week. And that's just because when you're new at something, it takes you longer to pick it up. And I think that's okay. Obviously, creating barriers and separating the two is really good. I'm not great at that if I'm just not great at that in general. So I did bring home a lot until I got good at it. And then it started just naturally being a separation. Now, sometimes I do still bring work home or I will stay at work later to chart. I don't like carrying my bag, but I'm like, let me just stay here and finish my charting and I'll go home. I'll start my routine for that later. But it just comes with time. Everything gets better with time.
That feels so true. And I really empathize with that feeling of when you're starting a new challenging work experience, figuring out where the boundaries lie is mostly just stubbing your toes until you stop doing it. So it sounds like you really figured it out for yourself. Yeah.
Well, I'm still figuring it out, but I definitely have gotten better at it for sure.
It does sound like though your days are very full. And so if something unexpected comes up or one of your patients who loves you is coming in, has a question for you, how are you handling these kind of unexpected challenges, emergencies, or last minute additions during your already very full day?
Yeah, I'm actually like, I say it that just like my patients come in and want to see me, but I'm saying that meaning obviously I will see them, but I can't say that it's just effortless for me because I'm super regimented. As you can tell, I don't like my schedule being off. I don't like being double booked. I like to go to the gym. So if anything falls by the wayside, it's always my gym time, which I hate, but it's just like a part of life. Or I will, instead of running to the gym, if I can't, like if I have to fit patients in, I will just go for like a short 15-20 minute run in between my patient time. So it doesn't happen a ton, but it is something that I'm working on, like being okay with patients needing me more than I think that they will need me. Patients just coming in and asking to be added to my schedule. It makes me feel good, but then it just adds more work. So, and I have to be okay with that. So it's hard. It's something that I do balance.
Yeah, it sounds like it's a delicate and difficult balance because you want to be accessible, but you also need to take care of yourself and not being able to go to the gym. It's not trivial. Like you need to focus on your physical well being as well. So it makes sense. And it sounds like it's challenging, but you're finding ways to make it work. Given how focused you are on efficiency and operating in a super efficient way, do you have any tools or technologies that you found really helpful, either in your work as an NP or posting social media?
Yeah, I use Up to Date. Like it's my Bible. Up to Date is the Bible for me. It has taken the place of God's word. Like it is installed on my phone, it's installed on my computer at work. And I feel like people's biggest complaint about Up to Date is that there's so many words, but there are so many algorithms, and I'm such an algorithm girly. Like, I love to look at something. I'm a very visual learner. So Up to Date is, like I said, literally my Bible. There's also an app called the 5 Minute Clinical Consult that is really good. I highly recommend that. And then I also have this is kind of trivial as well, but I have this like little book that I made when I was in NP school. And it's like everything that I thought I needed to know. And it has algorithms and quick things about meds to remember. So I bring this everywhere with me. And for social media, the app CapCut is my Bible. And I'm not sponsored by them by any way. I would love to be. I like edit everything through there and it's super easy to do. Those are my two things. Like if I had to go to a deserted island with internet access and my phone, it would be Up to Date and CapCut would come with me.
That's great. It's awesome that you've found your Bibles in both settings and that they're super useful for you. That's wonderful. We use CapCut a bit as well, and it's a fun
Yeah.
technology. It's really is quite great. Given your very busy and very structured day, what are the aspects that you would say you find most rewarding or most challenging?
Probably my most rewarding parts of my day are when I'm just like in the room with my patients talking. I always tell like the students who come through, like, that's your best time is when you're in there. The charting is so annoying, but you have to like let that fall by the wayside. I really do love just sitting and chatting with my patients, and I wish that I didn't have to chart about all of that stuff. So I love doing that and just having conversations about more than medical things too, just about their life. I feel like I know everything about a lot of my patients these days. So that's super rewarding. And then it is very rewarding at the end of the night too to post something and say it does really well. Responding to people's messages and things are resonating with people, that always feels good. It sounds, again, trivial, but those things bring me joy.
It's so clear that you love all of the components of work that you do, and it's a great way to operate, to really involve yourself in things that just like really feel right to you. And you were kind of getting at this, but I wonder what you would say sets your approach to patient care apart from others. In other words, when we ask podcast guests this, we like to ask them, what's your secret sauce that makes you such an amazing clinician?
My secret sauce is the fact that I know my patients. And again, I think it's because of working in primary care. My patients come in constantly. And it sounds bad saying that. I don't mean it in a bad way, but I know their kids' names. I know like where they went and traveled last week. I gave a tip one time on TikTok just about how to create like a good rapport with patients. And it can be something as simple as writing something important in the HPI about them that you want to remember and that you want to reference the next time they come in. Because patients really appreciate when you remember them personally. I know every time I go to my primary care and she remembers anything about me, it makes me feel like the most important person in the world, even though I know that she's seen 100 patients that day, but just that she remembered something about me. And I really try to connect with my patients like that. That's all life is connection, building relationships with people.
It's amazing how much emphasis you place on making your patients feel special and heard. And I'm sure that beyond that, giving them a great experience, it probably also has really positive impact on the actual quality of care and their health outcomes. So it's really nice that you're able to find the time and the space to treat each patient like they're your only patient. And that certainly feels like it's somewhat rare today. So that's really amazing. You mentioned that you see patients from cradle to grave, you have pediatric patients, and you also love your geriatric patients. Are there specific populations or conditions where you feel your approach especially shines?
I used to work in cardiology as a nurse, and basically I got inspired. There was a point in time where I was like, I'm not going back to NP school. I had gotten a job as an outpatient nurse in a cardiology office, and it was the world's most cushioned job. Like, I loved my life. I was making no money, but I was so happy. And it was coming off of working in the hospital, but there was a nurse practitioner there who was like, no, you're going back to NP school. Like, this is was always your plan, and you need to use your gifts to help others. And that was in cardiology, and he taught me so much, and I feel like I have used so much of that knowledge now. I feel like a lot of my expertise, if you will, are in treating cardiac conditions. So I'm super comfortable treating high blood pressure, high cholesterol, any type of problems with the valves. not reading echoes as in like reading them from a radiology standpoint, but reading the reports and knowing what has to happen next. I feel like I can kind of predict what's going to happen if I ever send my patients to cardiology. So I feel super comfortable in that aspect. I also, because of my time in GI, I learned so much and I can never discredit that. So I do feel very comfortable treating GI conditions, which is nice because I think that a lot of people nowadays get really scared if anything happens to them with their GI tract that they have, God forbid, cancer. So having that type of background and being able to walk my patients through, no, this is what we're going to do. It could be this, it could be this, but we'll figure it out together. I feel like really cardiology and GI are where I shine the most in practice.
It's awesome that you're able to integrate your past clinical experiences into your primary care setting, and especially given how important both of those areas are, cardiovascular health and GI health, it really is very special that you have specialized knowledge in those areas. Given your vantage point as a clinician and as a business person and a business owner, what are some future trends that you foresee for the NP profession, and how are you personally adapting to those trends?
One of the really big trends that we're seeing it now, but I think it's going to keep happening, is a lot of younger nurse practitioners and even younger physician assistants as well. When I originally got into the field, I'm quite young and I got a couple of years of experience as a nurse before going back. But one of my biggest fears was patients aren't going to respect me or think that I know what I'm talking about because I look so young. And it's actually been the complete opposite. Like, patients love that I'm young. They love that I have a fresh take on something, or that they have told me before, like, we love that you think about treating things in another way rather than some old haggard. I've literally had somebody say that before who's like been doing this for 50 years. And I was so worried about that. It has been so refreshing to see patients take so well to that. So I think that a great trend that we're going to see in healthcare is so many of our patients loving to see the younger providers.
That is so true. And having that energy and that ability to see the world in a modern, new way and being able to adapt to what is available today. People of all ages, of course, can do that. But there's something particular about younger generations where you're more open to new ideas and you're more willing to see different possibilities. We'd love to get into asking you some tips on the business side. I feel like we've learned so much from you clinically, but you're also a business person when you're not making your patients' day. So, what tips do you have for clinicians who want to establish a social media presence?
My biggest tip is super cliche, and I'm sorry, but it's just to be consistent. Like, you just have to get on there and you have to show your face and you have to do it every day. And no matter how embarrassing it is or you think that it is, it's that's just how you do it. Like, there's no recipe for success that is easy in regards to that. If you post one time and then you never post again, nobody's going to know who you are. And the whole point of social media is for people to know who you are. So you have to get behind the camera and you have to be consistent.
Absolutely. This is something that we've been hearing and that we've learned where just showing up online is a way then for people to get comfortable with you and to understand the kind of content you're into. Do you have any
Yeah.
tips for clinicians who are really focused on developing or growing their following?
My biggest tip would be to share like little tips. Like, people are looking for tips to make their life better in regards to the healthcare field. So much of us are like overworked, we're stressed, we know we have a very hard job. So even if it's tips that aren't related to healthcare, like little tips on how you take care of yourself, those are great things to share with people. Any small tip, anybody, not even in the healthcare field, is looking for, like I said, ways to improve their life.
That makes sense. It sounds like you personally have a lot of small tips, and so you're able to share those with your audience, and perhaps other clinicians do as well. And that could be a low barrier way to create some content that's really engaging and valuable. Stepping aside from social media, we know that you also have a business where you see patients in a medical aesthetics capacity. Do you have any advice for clinicians that are thinking about similar businesses or other patient facing businesses and how to acquire new patients?
Yeah, I think that's something that I'm still working on. We're still growing that business. It's pretty difficult in the medical aesthetics field because it's obviously not a requirement, it's a want. It's an extra thing and it's an extra expense, especially in our world these days. So I'm always looking for tips, but I think one of my biggest tips is, again, to post on social media. Like, how is anybody going to know about your business if you don't post about it? And people want to see what you can do. So people don't just want to see like fun little videos. Those do great as well, but people want to see your work. So putting out your work online is super important. And that's like personally what we are trying to use to grow our business.
It's great that you found a way to take your personal skills in social media and apply them to your business as well and to grow from there. So, thank you for sharing all of those tips. To close, we'll ask you the same two questions that we ask all guests, one on the healthcare system and one just a moment of reflection or advice. So, on the healthcare system as a whole, what changes would you like to see to really improve patient care?
There is so much that needs to change in the healthcare field. And I think it starts with insurance. Essentially, it all goes back to patients don't have access to what they should have access to, whether they have insurance or they don't have insurance. I think we need a complete healthcare reform in general. And I don't know all of the answers to how that would happen, but I think it starts with insurance and taking out the middleman.
Really hear you. And it's a challenge because patients need access to care and especially more expensive care. But then the trade off is that sometimes other parts of care are then managed by an organization that feels really far away from the patient, which then makes it challenging for the clinician who's really close to the patient to do the right thing. So, yeah, thank you for sharing that. And our final question is, what is some advice that you want everyone to hear or to walk away with? And this can be clinical or non-clinical.
Just like learn as you go. Just figure it out. Just do it and figure it out on the way. Like I said, and fake it till you make it. It's good advice for life. You will figure it out. You have to be gracious with yourself and remember that you're not going to know everything, whether you're new, whether you've been doing this for 25 years, you're still not going to know everything. You have to be humble and realize that life is a journey. It's learning along the way, and that's okay. That's what it is. So just be gracious and figure it out as you go. Be okay with that.
It's such a great message in terms of be confident, but also be humble and be open to learning, and you'll kind of figure things out as life shakes out.
It was such a pleasure to have you on today. I feel like we got so much wisdom and we had so much fun. And really excited to see how you continue to grow and inspire other NPs and truly make your patients stay. So thank you for your time.
Yeah, thank you guys so much for having me. I really appreciate it.